Coordinating Minister of Health and Social Welfare, Professor Ali Pate, says Africa must urgently embrace multi-sectoral solutions to curb the rising burden of non-communicable diseases if the continent is to achieve the Sustainable Development Goals and secure the Africa we want. Speaking at the West African Institute of Public Health 10th anniversary and 6th membership induction ceremony in Abuja, themed Digital Innovation and Shared Leadership for Africa's NCD Response, the minister highlighted the growing impact of hypertension, diabetes, cancer, and mental health conditions and other NCDs on productivity, household well-being, and national development. He stressed that NCDs, now among the fastest growing drivers of mobility in Nigeria, require action that extends beyond hospitals into areas like food systems, urban planning, environmental protection, trade policy, and social protection.
The theme of this gathering, which is non-communicable diseases, and particularly this segment, as was mentioned earlier, these are central to Africa's development priorities, as I said. They're going to shape our households' well-being, influence our labor productivity, and will ultimately affect the trajectory of our nations on this continent. In Nigeria, we know already, and it was in this room that 2.5 years ago we spoke to it, that NCDs are the fastest growing segment of our burden of disease due to lifestyle changes, urbanization, environmental exposure, and also aging, which is gradually creeping up on all of us. And we're approaching it through deliberate policy choices. And it has been demonstrated already that countries with high burdens of chronic diseases experience diminished labor participation, volatile health expenditures, and overall weakened fiscal resilience. So that is what we are contending with. And that's why the lens of public health and healthier public policies is an important lens to look at this as we begin to consider how to tackle this.